because you're only as old as your arteries. Okay? Now, I've got a bunch of fancy words up here, and I want to make a little sense of them, because if I'm going to give you the power to actually believe or think something other than the lipid hypothesis, I think you need to understand it. And I don't mean understand it like a biochemist or a physiologist or something like that, but I think you do need to have some concepts to begin to get to that next idea. Now, I'm going to present through here, hopefully in a relatively effective way, or short way, I should say, so that we can have some time for a break and some questions, because I want you to, please, if you can or if you care, dig into these ideas. Now, remember that endothelium, those tiles that line the arteries. Why do we care? Because you're only as old as your arteries. We want to keep them young. We want to get them younger if we can. What we've come to understand is it isn't as if you've got fat in your blood and it's some kind of sludge and it just sort of leaks into your arteries and sticks to the walls and gums up the works. That is not what happens. That's what the lipid hypothesis basically taught. It didn't teach it by malice. It didn't teach it by a conspiracy. It taught it by it building on the information that was at hand. But like many ideas in intellectual history, it has an inertia that has gone past where understanding has gone beyond that. So what I'm trying to get you guys to do is stop the inertia, look beyond and deeper than the lipid hypothesis. It's important to do that. Now, so we've got it in our minds. How do I make this go backwards? Anyway, remember, does everybody remember the artery? Okay, the endothelia. Don't forget them. Now, I'm going to just read this, and then we'll talk about it, because I want to introduce these words. What does cause damage to the endothelia, and the endothelia then subsequently causing damage to that structure? What's that? What does that? Immune factors. Talk about those words. Eicosanoids, prostaglandins. Talk about those words. A lot of you guys that have read Barry Sears have heard this word. Mechanical and shear forces, rip, tear, cut, just like anything else. End products of glycation. This is a really big one. Glycation just means glucose stuck on something where it doesn't belong. Inhibitors of endothelial function. Now that's different than things that might damage it, which is insult and infection, but it is something that inhibits the endothelia's capacity to respond to injury. Hi. Pardon me. I run hot. Now, whoops. How do I get back? I've been banging on that thing. Barry, do you know how to do this?
Should have a mask on.
Yeah, I would think so, but I don't see it. I'm just afraid I'll get it out of focus. There, okay, thank you. Does this go back too? It must.
Yeah. Not very easily.
Oh, okay, well then don't worry about it. Roger's good at that, obviously, thank you. Mechanical end products of glycation. All that means is glucose stuck in places it doesn't belong. Inhibitors of endothelial function, as I mentioned, that's different than damage to it. It's inhibiting their capacity to respond to injury. And, by the way, there's some surprising things on that list. Alcohol, histamine, insulin for sure. LDL migration, we'll talk about that. Reverse cholesterol transport, HDL, macrophage, depends on where you're from, I guess. So, lining of the tubes, we have an artery, it works fine, it's just like God gave it to you, it's nice and smooth, everything works, there's no problems, no damage, whether it's at the membrane layer or the endothelial or the muscular layer, all those layers are working fine. Now what goes wrong? Why do the arteries get older? Just like anything else, they get injured, and injury is inevitable. You get injured, you bump into things, you kick your knee or whatever. Injury is always a fact of life. So the fact that your arteries get injured is not surprising and is not why you get atherosclerosis, why you get arterial damage. Why you get it is you get damage that didn't get repaired. And like a cut, if it's bad enough, it heals as a scar. If it's reasonable enough, the body can heal it correctly and completely. And that's exactly the picture you need to have in mind for the lining of the arteries. Now, the reason why, and you say, why don't, okay, leave it at that, Doc, I'm happy, I get the picture. But let me tell you why I want you to know about these fancy words. Because these fancy words will power your understanding of why eating and exercise are probably the most effective intervention available. Not just sort of secondary or maybe why not try it. They are the most effective way to modify vascular risk. And if you don't kind of get some handle on this, you'll just have to take it on faith just like you did the lipid hypothesis, and I hope you don't just do that. I want you to think about if I can help you do that, please. So, immune factors. Now, why immune factors? Your immune system is, did it again. No, I didn't. The immune factors are what cause things to heal. They're important in every healing. Cut yourself, cells are attracted to it, chemotaxis, you know, a tractor beam if you're a sci-fi guy. Suck cells in there, those are immune cells, to begin the reparative process. The beginning of the reparative process is eating away the damage and repairing it with new stuff. That is a genetic thing, it's an immune thing. There's a lot of complex chemistry that goes on, but the primary chemicals have to do with what are known as cytokines. And cytokines are peptides and glycopeptides. What the heck is that? They're little pieces of protein, and tiny. They're just little strings of amino acids, or little strings of amino acid with a little string of sugar, glucoses. Not always glucoses, but sugars. Now, these guys, these cytokines, are 4 kinds, and you need to keep that in mind. Bear with me, it'll make some sense, I hope. The different kinds of cytokines are interleukins, tumor necrosis factors, interferons or interferons, and colony-stimulating factors. Those all have a role. Now let me tell you why you can take these words apart. Where is it? Interleukins. Leukins, just leuc is white in Latin, inter just means between. This means how white cells communicate. That's what an interleukin is. It's just how white cells communicate. White cells are your immune cells, right? So, how those white cells communicate and what they tell each other is what drives the repair process of those cells. Remember, endothelial lining the arteries. So interleukins, between white cell communication, is how things begin to damage and respond to injury and heal. The reason why I want you to get that thought is it's not, oh, don't eat fat, I'll be fine. It's you've got to make your immune system better. That's how you get your heart disease better. Your immune system has to work better. Cytokines are both pro-inflammatory and anti-inflammatory. They tell the white cells to produce certain proteins and tear down other proteins. They're very, very complex signaling molecules. So we don't have to get into that. Just understand, your immune system is what initiates injury, is what mediates injury after an infection. Infection causes a lot of arterial disease, by the way. Cytomegalovirus, chlamydia pneumonia, Helicobacter pylori. There are a lot of organisms that have been implicated in causing the damage to what? To the tissues that line the cells, which are the tiles, which are called endothelia.